The number of coronavirus cases continues to rise. The death toll has now reached 1,115. The number of confirmed cases now stand at a whopping 44,200. The World Health Organization has renamed the deadly novel coronavirus as COVID-19. Now, this comes 6 weeks after the virus was first identified in the Chinese city of Wuhan. Meanwhile, the Director General of the World Health Organization, Dr. Tedros Adhanom, said that having a name matters as it prevents the use of other names that can be inaccurate or stigmatizing. He also said that the name did not refer to a geographical location, an animal, an individual, or even a group of people.
We now have a name for the disease, and it is COVID-19, and I will spell it. COVID-19. CO stands for corona, as you know. VI stands for virus, D for disease, so COVID.
We are going across live to Hong Kong, where our correspondent Bruce Harrison is joining us live. Bruce, 44,000 people are now confirmed to have been infected by the coronavirus. The numbers just keep on rising.
That's right, 44,000 plus the latest total. Deaths have now climbed above 1,100, I believe, as it stands at this moment. It's 1,113 people have died from the disease, mainly on the mainland. There has been one death in Hong Kong, where I am right now, and several others throughout the world, but most of that death has taken place within Hubei province, where the outbreak started. The Chinese government wants to limit the spread, and officials say that despite the numbers climbing as far as deaths, the rate of confirmed cases, the spread is slowing, they believe. But it's unclear. Other experts will tell you it's hard to say exactly when this could peak and the downfall really starts. But China wants to get back to normal. One of the biggest measures they've announced today is they're going to see that 160 million people across the country can get back to work to limit the economic impact from the coronavirus. And they say they're going to take some steps, including limiting the number of seats on buses for long-distance trips. They're going to do better sterilization efforts throughout cities, throughout the country, to make sure public transportation is safer. Those are two of the key steps they're going to take, and they hope that will convince people it's safe to come together in large groups and go back to the workplace to get the economy back on track.
Absolutely, Bruce, but the concerns remain, isn't it? They're not going to die anytime soon, because the World Health Organization has said that a vaccine could take as much as 18 months.
That's right. The word from the WHO is a bit concerning, considering how long it could take to come out with this vaccine. But there are treatment measures in place. Many people have already been released from hospitals on the mainland, as well as here in Hong Kong. And the death rate outside of mainland China is quite low. Hong Kong officials here have said they believe the city is in a containment stage at this point, and it's just a matter of continuing to take the proper steps to ensure the safety of the population. So without a vaccine or not, they believe that through proper precautions like this mask I'm wearing, washing your hands, and making sure that they sterilize public transportation, they will eventually be able to ensure the safety of this city. And officials throughout the region feel the same way as well, whether it's South Korea or Japan.
Right, Bruce, I'd like to thank you for joining us. We'll keep coming back to you for all the updates live from Hong Kong.